Welcome and good evening, everyone. My name is Michele Storms. My pronouns are she, her, and I'm the executive director at the ACLU of Washington. I'm speaking to you from the traditional land of the first people of Seattle, the Coast Salish people, who have stewarded this land for generations. Our ACLU office downtown sits on the unceded territory of the Duwamish people. We must always remember the role our country played in stripping the first people of their land, culture, and language, recognizing there's so much more work we need to do to make the country fair for Indigenous people and for all people. Our Flights and Rights events are typically hosted in breweries and event spaces around the state, most often the gathering space of KEXP 90.3 in Seattle, kexp.org. KEXP has been an important partner over the years, even though we've been virtual for the past year. So even though we aren't together in person, we do have flights to go with your rights. So if you are in the Seattle area, you can visit the Georgetown Brewery and mention ACLU's tab for $5 off tonight. Details are in the chat box and on our website. Also, everyone in attendance tonight has been entered into an ACLU of Washington Supreme Swag giveaway. Our prize package includes KEXP and ACLU koozies. These are items you can't get anywhere else. We'll draw names after the event and notify 3 lucky winners by email tomorrow. Let me switch gears now. It was exactly 1 year ago today that George Floyd was brutally murdered in broad daylight by Minneapolis police officer Derek Chauvin as he pled for his life for more than 9 minutes. His murderer is being held accountable by the criminal legal system, but we know that true justice would mean George Floyd still being alive today. George Floyd should still be alive today. These words will be projected onto St. Mark's Episcopal Cathedral tonight, which can be seen from all over Seattle. Tomorrow night and every night through June 8th, we will be projecting more than 30 names of people who have died at the hands of police in Washington state. In Washington, about 40 to 50 people are killed by police officers each year, and the victims are disproportionately Black, Brown, Indigenous, Asian American, and Pacific Islander Washingtonians. You can look at projectingjustice.org to learn more about the victims' stories and this project. So, has anything changed in the past year since George Floyd was killed and since communities protested on a scale not seen in this country? Well, unfortunately, a lot remains unchanged. Police still kill about 3 people a day. Nearly 60% of police killings this year started as a law enforcement response to traffic enforcement or a mental health need. Black people are still 3 times as likely to be killed by police than white people. Police officers are still protected by qualified immunity. Your ACLU is working with allies nationwide on new approaches to public safety. We're working with elected officials, we're in the courts, and we're informing voters. There has been a general shift in what happens before people are involved. For instance, in Brooklyn Center, Minnesota, the ACLU and local allies work closely with the mayor and city council to pass a sweeping law that will create a new department to send mental health workers instead of police in many situations, start a civilian traffic enforcement department that would have prevented the death of Daunte Wright, and prohibit arrests in many situations that currently result in confrontations escalated by armed police. Voters are passing laws to curb the most violent and dangerous police tactics like chokeholds and no-knock warrants. Here in Washington, we passed 14 bills through the legislature just this past session to hold police accountable. I can assure you we will continue to fight the legacy and current presence of racism and violence within policing. This is a part of our fight for systemic equality. Now, for tonight's talk, we focus on another aspect of our race equity work: healthcare equity for immigrants. With that, I'm very excited to introduce our panelists. First, we have Adriana Ortiz. Adriana is a Colombian attorney with more than a decade of legal practice defending and promoting human rights. Adriana pursued her LLM in Sustainable International Development as a Bearer Fellow at the University of Washington and has postgraduate degrees in human rights, constitutional law, and liability. During her professional experience, her work centered on defending, protecting, and promoting the rights of vulnerable population groups, particularly rural people, women, children, and victims of internal armed conflict. Adriana has worked for international cooperation agencies such as USAID, international organizations such as Oxfam, and several nonprofits and state entities. In 2017, Adriana joined El Centro de la Raza as the Sensitive Locations Project Coordinator. In this capacity, Adriana promotes the implementation of the sensitive locations policy throughout Seattle and King County, conducts Know Your Rights training for immigrants, and implements emergency safety planning for undocumented families. Tonight, we'll also hear again from Michael Byun, who joined us as a Flights and Rights speaker last May. Michael is Executive Director of Asian Counseling and Referral Service and has worked for nearly 25 years on health disparities, social justice, and immigrant and refugee issues, with a focus on Asian American and Pacific Islanders and other underserved communities. Before his ACRS appointment in December of 2018, Mr. Byun served as CEO and Executive Director of Asian Services in Action, the largest health and social services agency in Ohio, focused on empowering AAPIs, immigrants, and refugees. Michael has served on several state and national boards and advisories within the AAPI community. In 2015, he was appointed by Ohio Governor John Kasich as chair of the Ohio AAPI Advisory Council, and in 2014, appointed by President Barack Obama to the President's Advisory Commission on Asian Americans and Pacific Islanders. He currently serves as board chair for the National Coalition of Asian Pacific American Community Development and is a founding member for the National AIM for Equity. Leah Rutman rounds out tonight's group. Leah is Healthcare and Liberty Counsel here at the ACLU of Washington. Her job is to protect people's access to reproductive, end-of-life, and LGBTQ+ healthcare. Prior to joining the ACLU in 2013, Leah practiced commercial litigation at an international law firm and worked and volunteered at various human rights organizations. Leah is a graduate of McGill University and Columbia University School of Law. Outside of work, Leah can be found exploring Seattle beaches and hikes and spending time with her kids. Our speakers have a lot to share with you, so let's begin with brief introductions from each of them so we can know a little bit more about the larger work of their organizations. Adriana, may I ask you to start?
Hello, everyone, and thank you for inviting me to this event and share our experience at the Health Equity for Immigrants campaign. I work at El Centro de la Raza, that is a community-based organization based in Seattle. El Centro de la Raza works promoting and defending the rights of vulnerable communities, particularly immigrant communities, and providing direct services to people that need them, such as educational services, um, uh, legal services, and advocating for these populations.
Thank you so much. Michael, good evening.
Yeah, good evening, everyone. I'm Michael Byun. I use he, him pronouns. I'm the Executive Director for Asian Counseling and Referral Service. We're a 48-year-old social justice organization rooted in community. We started when activists and School of Social Work students realized there were major disparities as it relates to healthcare access, specifically to mental health services. As a result of community's collective action, ACRS was founded, among other important organizations that serve the Asian and Pacific Islander community here in Seattle. I also want to say that our organization, while we are grounded in our health and social service work, we always think about centering our communities and also what it means to empower communities. And that is a core to the work that we do each and every day. Thanks for having me.
Thank you so much. Leah, your turn to say hello.
Hi all, I'm Leah Rutman with the ACLU of Washington, she, her pronouns. I'm thrilled to be here tonight with such distinguished panelists. Thank you. The ACLU's work engages in so many different areas. I focus on healthcare, but we work on policing, we work on immigration, we work on so many different issues. And while traditionally a lot of our healthcare work focused on reproductive health, end of life, and gender affirming care, which we still do and are so incredibly important, that intersection really made us reach further and realize the importance of health equity and being engaged with this work in this space. So really excited to be here for this Flights and Rights.
Very much. I appreciate that introduction that each of you gave. And Leah, I'm going to just keep you on the mic for now and ask you to tell us a little bit about the Health Equity for Immigrants report that was released this past December, because I think that that report kind of helps to center and ground our conversation and what it is we're talking about.
Absolutely, happy to do that. So last year, as the ACLU and other advocacy organizations were discussing sort of short and long-term advocacy around immigrant healthcare, we were very cognizant of the fact that too often advocacy fails to center community. And I think Michael was already talking about that to a little, but the importance of it. So with this in mind, the Washington Immigrant Solidarity Network, with assistance from various organizations, including El Centro, ACLU, and many others, the UW, Casa Latina, Latinx Health Boards, Latinos Promoting Good Health, Northwest Health Law Advocates, I could go on, developed a survey on immigrant healthcare needs to ensure that any work we did around health equity for immigrants was grounded in the actual needs of the communities we were trying to serve. The survey was distributed across the state in the fall and translated into 10 different languages. Respondents to the survey were over age 18 and ineligible for state-funded health insurance options, such as Medicaid, due to their immigration status. And to provide a little context there, due to federal restrictions, undocumented immigrants are ineligible for Medicaid or qualified health plans, so they can't participate in the exchange. So many of them have absolutely no way to obtain affordable healthcare coverage. 5,728 people completed the survey, and those respondents lived in 36 out of the 39 counties in Washington state. And that was really important for us because we wanted to get the perspective from people from different locations. So a few key findings from that survey. 87% of the respondents reported that they did not have health insurance. Just take a minute to realize what that means. 87% of the respondents. Most cited lack of immigration eligibility, 62%, and costs, 46%, as the primary reasons. Many individuals reported being unable to access key healthcare services. The top 3 reported were primary and preventative care, so all the basic care we all need, dental and vision, as well as access to medications. Survey respondents also reported facing severe financial instability, with 90% reporting a loss of a job or lower income since COVID began, and 85% reporting working paycheck to paycheck versus 55%, I believe, prior to February 2020. What this very clearly told us was that many respondents required a state-funded program. They could not afford to pay for health coverage on their own. Many respondents were essential workers. 95% reported that they could not work at home during the pandemic. These communities heavily represent the population of essential workers who have had little or no option but to risk their health during the pandemic to support themselves, their families, and all of our economies. And yet these same communities did not have access to basic healthcare services. The results of the survey, as well as the results from focus groups that I think we will hear about later from Adriana, were compiled together into a report. The report has been an extremely important tool in highlighting the grave inequities in our healthcare system and helped the campaign decide on steps forward in our advocacy. I think the report is likely available in our chat. Yes, it is, for people who want to look at it. And I just wanted to raise it up again as for those who haven't previously heard about this issue, it's really stark the inequities that exist. Thank you.
Thank you, Leah. Yes, that is absolutely disturbing for so many people to be without the most basic of care. And I think we all understand that when even some small subset of our community is unable to get health care, that has an impact on the health of the entire community, right? The broader community. Michael, I thought I might turn to you and ask you to comment on that, like what we learned from this survey and what role ACRS is playing in trying to address these dichotomies.
Yeah, thanks, Leah, for providing the summary, and Michele for your question. I think as we're thinking through this as a community, as an organization, one of the things that's really important is that the undocumented communities are also within our Asian and Pacific Islander communities as well. So some important statistics to look up here in King County, where ACRS is located, 15% of Asians and 19% of Native Hawaiians and Pacific Islanders are uninsured. And in a recent 2018 Kaiser Family Foundation survey report showed that nationally, 21% of Asians and 14% of Native Hawaiians and Pacific Islanders are ineligible for health insurance because of their immigration status. And one of the other important things in our community is that we are disproportionately represented by a number of community members who are in informal economies, rideshare, food delivery services, family-run businesses where healthcare coverage is inconsistent or not accessible. And recently with the pandemic, and then with the double whammy of the rise in anti-Asian hate and violence, there's a high level of anxiety, depression, tragically also suicide in our communities. And this, in addition to the community grieving related to the Atlanta killing, which included 6 Asian women. That's really why we need to have access to culturally and linguistically accessible services, which is what this report is also lifting up.
Thank you for sharing that. Adriana, how is El Centro getting involved in these issues, and what are some of the things that you all are working on right now?
So, as I mentioned, El Centro de la Raza is a community-based organization that for decades has worked on the promotion and defense of vulnerable populations' rights, particularly the Latin immigrant community. And through all these years, we have been aware that people of colors have faced racial and ethnic health disparities. This is evidenced by the higher prevalence, incidence, and burden of health conditions, as well as in the higher mortality rate these communities face. So for the Latin community specifically, these disparities are rooted in the inequalities that Latins endure in their daily life because of the challenging social conditions that they are exposed to, such as the lack of or the low quality access to healthcare, education, employment, food, and safe neighborhoods. So with the pandemic, these disparities became more evident at the same time that healthcare access started to be in the spotlight. Therefore, we thought that it was the perfect timing to bring awareness about the barriers on healthcare access that immigrants face, and at the same time to start advocate for ensuring healthcare accessibility for immigrant communities in Washington state. So, however, we were aware that we won't be able to do that by ourselves. That's why we first partnered with the Northwest Health Law Advocates and to start gathering information regarding healthcare access for immigrants and advocating for healthcare rights. And then we invited other community leaders and community organizations to join our efforts, and there's how the Health Equity for Immigrants campaign was created and started working. And we are now more than 20 organizations advocating for healthcare access for immigrants.
That's really inspiring. Like on one hand, we hear about the survey and just the dire circumstances that people are dealing with. And then we hear from Michael that quite a few more people are impacted by this issue than most uh, folks realize. And then we hear that, so as a result, you've come together to create this campaign. Leah, maybe I could turn to you and talk a little bit about some of the things that the campaign achieved during the legislative session.
Sure, absolutely. And I think it was pretty impressive what this campaign of sort of community leaders and healthcare providers were able to achieve in a really short period of time. So during legislative session, the campaign was initially advocating for a bill that would create parity in health insurance coverage to ensure undocumented immigrants would have access to a state-funded health insurance program. The bill in question, if anyone wants to check it out, was HB 1191. It was sponsored by Representative Tai, who's a great advocate on these issues. It would have required two things. It would have required that a state-funded health insurance program would be provided to individuals who would otherwise be ineligible for Medicaid due to their immigration status. So for example, if you were at or below 133% of the federal poverty line and fulfilled the other requirements for Medicaid, but you couldn't get Medicaid because of your immigration status, there would be an equivalent program. So you would get equivalent health insurance coverage and it would be provided by the state. At the same time, that doesn't solve the problem of the people who aren't eligible for Medicaid, but should be, but aren't eligible for the exchange. And so it also created a program to offer health and dental plans through or alongside the current exchange that were the equivalent of the plans on the exchange, but would be offered to people who were precluded because of their immigration status from purchasing plans. So this was, we thought, a pretty effective way of achieving parity in healthcare coverage. Unfortunately, as is often the case, due to various political considerations, that bill did not move forward. However, the campaign quickly pivoted to a budget strategy. And ultimately, two budget provisos were included in the final budget that I think were pretty significant steps forward. The first one was a proviso that allocates $35 million to be distributed as grants for the provision of healthcare services for uninsured and underinsured individuals, regardless of immigration status. So very importantly, this proviso includes language that requires agencies to engage community residents, organizations, and leaders in identifying healthcare providers and priorities, and to engage with healthcare boards. So the funding should improve undocumented immigrants' access to affordable care in the very short term. The second budget proviso addresses our long-term strategy. It allows funds to be used for government agencies to explore opportunities to enroll currently excluded populations, so such as undocumented immigrants, in a state-funded health coverage program by 2024. I want to be clear, this doesn't mean that program will be set up, but it is giving government agencies, the agency, see what I did there, to consider it and develop ways that we can get there, which is so, so, so important. So there's still a lot of work to be done, but I think what the campaign was able to accomplish this year are really an enormous step forward in getting where we need to go.
Yeah, that's really exciting to hear. And I really salute all the participants in the campaign for making that pivot. When the original bill wasn't going to pass, figuring out a way to set a stage to create some of the programming that we know we need so that vulnerable people in our state can get healthcare. Michael, I wanted to ask you something because, we've been talking about government programs and who's eligible and who's not eligible. And a lot of times we hear, particularly around undocumented communities, this question of public charge and what that means. And it's a pretty fraught term and a pretty fraught policy related to that. So I was wondering if you could talk a little bit about that and how that impacts this work.
Yeah, thanks so much for that question. So for the broader audience, this idea of public charge is this notion, and I'm not an attorney, don't have the specific legal language but for the purpose of explanation, it's really about eligibility to go towards to naturalization, immigration and naturalization process, and not being necessarily a ward of the public, specifically in accessing benefits in terms of like Medicaid and others. So in 2018 of October, and Leah's here, Leah's the attorney and can clarify and provide more language there. But in 2018, in October, the former Trump administration had issued a proposed set of rules regarding public charge, which had a very chilling effect. Immediately in the announcement of the proposed rules within the Asian community, there were documented situations where community health centers that were providing safety net services saw their waiting rooms completely be without people, without clients that were regularly coming in. Because of the fear that by accessing the healthcare, those really important healthcare services, that they might somehow trigger public charge and then prevented eligibility in terms of immigration status. So already that was having a very chilling effect. And through the advocacy at a national level with One Nation Asian and Pacific Islander, One Nation AAPI initiative across the country, there was this massive mobilization to do greater education around community around who's eligible, who's not, what should you know about in language so it's readily available. And there was also a major push to submit comments, public comments to oppose the rule. And the efforts resulted in several hundred thousands of comments being furnished in terms of the proposed rule that was put out by the Department of Homeland Securities. So fast forward, there were a series of court activities where there was a preliminary injunction and went through different court systems. And then as a result, later down the road in 2021 in March, with the new administration, and the Secretary Mayorkas had recently in early March, issued a final decision to remove all the 2019 public charge rules and revert back to its original. So I share this information, giving you the timeline, because it did have a major impact in terms of the communities who, during this whole time of chaos, where our communities, especially those who are faced with language and cultural barrier, not necessarily sure if they can access critical services. So the work that we're doing right now with this coalition here at the state of Washington is really important, because it addresses the need for access for those who are undocumented or those who have immigration status that might prevent them from accessing Medicaid.
I really appreciate that. Leah, did you want to add anything since you, okay. Yeah, and I just want to emphasize again, just for us to think about in terms of policy, when one subset of our community is not getting their healthcare needs met, it has an impact on all of us. The ripple effect is all of us, whether it's sickness and disease, whether it's people's inability to work, we're all impacted. So we're all better off if everybody has access to healthcare. Adriana, I'd like to turn back to you, because we had referenced earlier the work that you have done at El Centro related to focus groups and what you've been learning from doing that process and what lessons you're drawing from that. Would love to hear more about that.
Yes, I think it is important to mention that the campaign was initially thought as a bottom-up campaign, meaning that it was the community and the impacted community members, the ones that will identify the gaps on healthcare access, and the ones that will identify what would be those policy or bills, ideas that will make us achieve affordable healthcare access for immigrants. So I think that's very important to mention, because this campaign was not thought or by by the leaders of non-profits or policymakers, but it was the community and the impacted community, and particularly immigrants, the ones that gave us the information regarding healthcare needs for immigrants communities. And this was through the surveys that Leah already shared with us, and also through some listening sessions that we held with impacted communities. And some of the results of the listening sessions that we held last year with the immigrant communities gave us the ideas to bring all the bills and the proposals we presented to the legislative. Some of these were that participants expressed a need for access to comprehensive and affordable health coverage. Immigrants also inform us that they continue to face difficulty accessing primary and preventive healthcare, behavioral healthcare services, dental, oral healthcare, vision services, prescriptions, long-term care services. And they also express that affordability remains an issue. We also found that transportation is still a barrier to care. And participants expressed interest in coverage and reimbursement for cultural remedies. So I think this was very important, because actually when the campaign started, we were not aware, for example, that dental and visual health was an important issue. We always thought that it was like the most expensive, or probably the most long-term services, the ones that were requested by the community. But actually what they were calling for was preventive healthcare access, behavioral healthcare access, and vision and dental healthcare. And I think that shows us how important it is to involve the community in these type of initiatives, because at the end, they are the ones that have the answer to the issues that we want to solve.
Thank you for sharing about that. And, oftentimes people underestimate the importance of dental and vision care, but especially when you're talking about kids, for example, if you need glasses and you don't get them, your educational outcomes are just really not going to be good, right? And then dental problems can lead to other physical health problems, right? So it's wonderful to hear the community speaking out so powerfully about their own needs, and just the recognition that all of these healthcare issues are interrelated. So here we are talking about health, right? And as it turns out, we are still in a global pandemic. Many strides have been made, but we are still in it. There have been issues about access to vaccination. There have been issues for people who have contracted COVID and had long-term issues. I thought, Michael, I might turn to you and ask how you're seeing the impact of COVID-19 still showing up in the communities that you serve.
Yeah, I think rather than focusing on the adverse impacts of the pandemic, I want to focus on things that remind us of resilience in our community, and one specific, and then also the power of community. A really important example is that a community member, Trang Tu, who noticed that there were major disparities early on during the vaccination efforts, major disparities in terms of access issues for our communities. And she brought other individuals together, community members and organizations, to talk about how can we work together to more effectively address some of these impediments, some barriers, and other limitations. And as a result of the work of an individual bringing others together, there were a real important effort in creating additional criteria early on in the phases to allow for greater eligibility and of eligibility so that individuals can have access. And so that was as a result of an individual who saw challenges in the community, mobilized community to work together and to call for change, to change the guidance in terms of who was eligible. And so it included individuals who resided in multifamily homes. And that was an important provision that was included during the early stages of the vaccination rollout. So when I think about that, I think about also the fact that this month is Asian and Pacific Islander Heritage Month, and not recognizing that as much as we face so much adversity, recognizing that people and community have our backs, even during challenging times. And not only just within our own community, but the community that we are around, our BIPOC community and others who are so supportive during this time. So I think that's something that I wanted to just convey during this time. So thank you.
I love that. And I really appreciate it, because if there's one thing that has been demonstrated across many communities that often find themselves in vulnerable circumstances, is truly resilience. It's getting through on the other side. It's fighting for, our rights to have access to the things that we need for our families to thrive. And that is absolutely inspiring. So I think, Leah, now I will ask you, you talked about what happened in the last legislative session, which was also inspiring, because even though the campaign didn't achieve its original goals, it did a really smart pivot. But every year we get a legislative session. And so I'm curious, like, what are some of the things that you all are thinking about and hoping that you might be able to accomplish legislatively?
Great, thanks, Michelle. So achieving parity in healthcare coverage is obviously a key goal the campaign has had, and we made great strides this year, but there's still a lot of work to be done to create parity in coverage for immigrants. And I hope the campaign is able to continue working on that as we move forward. But as I think Adriana really eloquently has said, we're really aiming to center communities and what the community wants and needs. So in the interim, what we will be doing is going back to the community and going back to the community leaders and understanding what they want to do for the next session and what they want to push for, as well as during the interim, because a lot happens in legislative session and a lot happens that doesn't occur during legislative session. What I will say is that along with healthcare coverage, which is so key, there is so much more to health equity, right? You hear various definitions of health equity put out there, but one of them, I think it was the CDC, I can't remember, but is about when each person has the chance to reach his or her full health potential without facing obstacles from social position or other socially determined circumstances. That is such a big, broad issue, and there are so many ways to take that on. So what I'm really hoping we can see in the campaign or for the next year is, how do we work together to raise up what the community wants us to raise up? I suspect they'll want to continue working on healthcare coverage, and that there will be many, many other ways to also address other health disparities that need to be addressed.
That's really great to hear, Leah, and especially great to hear that the next step is go back to community, reassess where we are from what was achieved this last session and what needs to come next. I think it's great that you also just mentioned this question of what health equity is, because it is really a lot of things. And I'm just wondering, from both Michael and Adriana, from your perspectives, how you're sort of defining that term, and what are the other things that you and your communities are thinking about in terms of achieving health equity beyond, the access to healthcare. Not that that's a small thing, it's a huge thing. Michael, how about you go first?
Yeah, I think that the last year and a half has really been an awakening for our communities as a whole. And we are learning some incredible, valuable lessons in terms of how we think about our work, our community. And so in terms of thinking about health equity within our own Asian community, there's a couple of things that come to mind. One is around understanding health equity that we want to achieve for our Asian community must always center those who are most impacted, which is our Black and Brown community. And so part of the internal reflection that our community is doing is how do we continue to deeply understand the roots and connections of our communities and how we're tied together, and also understand what the challenges and the adversities and the barriers that our Black and Brown folks are confronting. The other important thing within our own community of Asian and Pacific Islander community is recognizing and honoring individual voice and sovereignty of groups. So one particular thing that we are spending more time in understanding and lifting up is our Native Hawaiian and Pacific Islander communities, having very unique lived experiences versus those who are Asian American. And so part of that also means is how do we ensure that they have a seat at the table and that we're not speaking for them. And also honoring and making space for their leadership. So these are important conversations that we're having as we're thinking through health equity and equity in general.
That's really great. I appreciate that. Adriana, would you like to add to this? How are you all thinking about health equity?
Well, I would add that health equity includes both participation and information, access to information. And I think we'll need to focus on those two issues. First, because I think because communities, as I said, are the only ones that are really aware and the ones that know their own needs. And it's also important that they be informed. And when I say they should be informed, this goes beyond a web page of a healthcare provider that is translated to any language. And I think that we need to be very aware of that, because what I've seen so far is that information so far is understood that way, a translated web page. And I think information should be like the next step of the campaign as well, not only because we need to ask them what they will need and what will be the next step, because we need to bring to the community the proposals that were approved, to let them know the services, the resources that are there for them. And also because I think the community needs to start monitoring all these new services, all these new resources, and they need to know how they will be spent and how they could access them. So I think information to the community will be the next step for the campaign, as long as engaging them in the upcoming initiatives that we will come up with.
That's so great. Right. Like, I just love the approaches that all of you are taking to doing this work, in the way you're centering community, in the way you're broadening the question of what it means to have access and equity. It's everything. It's information, it's actual services, it's language access, it's all of these things. So I think as we wrap up, because it's really basically time to wrap up, and I don't see any other questions coming from the audience. So I thought I would just give you each an opportunity if there's anything else that you wish to add for the good people who are here to hear about, anything that you want people to understand or to think about or to do. I want to give you that chance to share that. So I'm going to start with you, Michael, if you don't mind.
Yeah, one of the things that I've been really encouraging people during these panel opportunities is just to continue to practice self-reflection and building empathy, and specifically building social empathy, which is one that is really needed to fully understand those who don't look like us. So part of the work that we're asking during the celebration of Asian and Pacific Islander Heritage Month is our own work and our own reflection and our own building of our own social empathy. So that's what I would leave today with everyone.
That's outstanding. Thank you, Michael. Adriana?
No, I will invite everyone that is interested to join the Health Equity for Immigrants campaign. We first thought that it will be only a one-year initiative that will end up in the last legislative session, but this experience have shown us first that we still need have a lot of work to do, but also that definitely when we come together, we can achieve great things. And so you are all welcome to join the campaign, because we will continue working for a long time, I think.
I think you're right, right? Inclusion matters for sure. Leah, I'll let you have the last word before, I get my last word.
I think Adriana's last words were fantastic there, so I'm not sure. But I guess I'd just say to continue to try to look at health equity and healthcare in a really holistic way, and not limit it to thinking about it in the way that you access healthcare, because there's so much that comes into it and so much privilege and power that relates to the healthcare world that a lot of people probably just aren't thinking about. So just really broadening your scope when you think of healthcare access and health equity.
Well, that sounds amazing. And I really appreciate each of the three of you for giving up some time this evening on this so-so spring day here in Seattle, and really sharing from your expertise, sharing from what you've learned from community, and encouraging all of us to expand our horizons in our empathy and in how we think about healthcare. So big applause to Adriana, Michael, and Leah. And as we wrap up, I want to thank all the people who came today to watch this. I want to remind you that the Georgetown Brewery is open till 7 o'clock if you want to get that ACLU tab. And we will be back next month with another Flights and Rights on a topic I'm not sure if we've yet determined, but it will be great. And so from all of us at the ACLU and our friends and partners and allies, we're grateful for you, grateful for your resilience, grateful for your solidarity. I hope you will make a way to see the projected names and messages at the St. Mark's Episcopal Church. It is really powerful. It is really meaningful. What happened a year ago was very galvanizing. It wasn't the first time we had seen a video of a Black man being killed by the police, but it was particularly brutal. It was particularly terrible. And it has awakened something in many people to try to make things be different, for public safety to also be thought about in a different way. And it is always important for us to continue to say those names. And that's what we're doing with the project and with the partners engaged in that. So I hope you will make a way between now and June 8th to check that out. I wish everyone a great evening. Take good care. Be safe. Bye-bye.